We're so happy to be celebrating the 10th anniversary of the Steeplechase Cancer Center at Robert Wood Johnson University Hospital, Somerset. When we started planning the Cancer Center, we involved the voices of patients and their caregivers to help us figure out what would be the best way of delivering cancer care here in central New Jersey. Their voices were heard, and now 10 years later, we're really happy with the result of having a cancer center right here in the heart of central New Jersey.
Coming here, I found that the attitude of the personnel was good, the atmosphere was great. As I stepped off the lobby into the treatment center, I just got a feeling that I was in a different place and that and I was welcomed.
Over the past 10 years, we've had almost 11,000 patients diagnosed with cancer. We've had 2,100 patients on clinical trials to help us cure cancer, 132,000 breast mammograms and procedures, 4,100 people quit smoking, and 900 lung cancer screenings. But it's not the numbers that are important. It's the patients and the care that they receive from our team effort.
I wasn't just a number, I wasn't just a name. They cared about who I was, how I was feeling.
The technology we have here is comparable to almost any other facility in the world. We have great radiation technology enabling us to do such things as stereotactic body radiotherapy. For instance, we used to be able to treat a prostate cancer in 8 or 9 weeks. We now can do it in 5 treatments for early stage disease.
We offer minimally invasive surgeries, laparoscopic and robotic surgeries. The benefits are less pain, small incision, speedy recovery.
We take a holistic approach to cancer care, addressing mind, body, and spirit. Our support groups run the gamut from Reiki, Tai Chi, and exercise programs to psychosocial support. We are working with the cancer support community on many different kinds of support groups for women, for men, for multiple myeloma, many different types of support groups here. We went from 8 to 22 in the 10 years we've been here.
I started attending a men's cancer support group here at Steeplechase. We're someplace where people can go and have a refuge, and that's rewarding. We have bonded. I mean, we're here to support each other.
We have multidisciplinary teams in breast, colorectal, prostate, and lung cancer, where we review patients' cases in a multidisciplinary way with medical oncologists, radiation oncologists, surgical oncologists, radiologists, and pathologists, as well as our team of ancillary personnel.
We're one of the few cancer centers that actually has its own boutique. There are hats and scarves for people who've lost their hair secondary to chemo or radiation therapy. There's a whole range of things that are designed to make the patient feel better about themselves, and I think that's very unique.
I can't say enough about Steeplechase Cancer Center. Everybody that worked there was so supportive and caring.
All of this obviously cannot be done without a lot of financial resources, and we've been very fortunate to have Steeplechase named after the Far Hills Race Meeting Association, which has donated $18 million to the hospital since the 1950s. We're also very fortunate to have the Somerset Healthcare Foundation as a significant donor. We also have the Steeplechase Distance Run that was started by one of our physicians. That's raised a lot of money.
Every day when I walk into the Cancer Center, I'm amazed at what we've been able to accomplish in the last 10 years. We are all so happy to see what we've been able to do for patients and their families.